Support for Your Fantastic Mind, provided by Southern Company Foundation.
Welcome to Your Fantastic Mind. I'm Jay Watson. It has been quite a year for our minds, hasn't it? We entered 2020 not knowing that a global pandemic would change the way all of us live, that it would cost millions of jobs and hundreds of thousands of lives, that we would add new words to our vernacular: socially distanced, shelter in place, quarantine, online learning, Zoom meetings. So we're going to examine the impacts of COVID-19 on our brains and our minds. And while we're all very different, for many of us this year, our lives have looked remarkably similar in certain ways, which is why we begin this week at home.
Hi. Hey! Yay!
Ty is 12 and Crew is 10.
That was awesome. Serve me, Ty.
The oldest is Jace, and Autumn is 19.
The Kleffner siblings have always been close, but never like this.
Do you have a slicing knife? It's been really nice to be together in our house, all of us. Yeah, I wanted 10 kids.
Yeah, I had her negotiated down to 8. I wanted big
And then we
family
just
too,
got
so
too old.
We were on the same page, but then.
Really? Ups it up. No, you just are all fame.
Ty is Ethiopian. Crew was born in Denver. He was in the foster care system.
It makes me wonder on the reality shows.
The challenges for Andy and Brett Kleffner are shared by parents around the world, living under one roof, working from home, schooling from home. What was online school like?
It was torture.
Celebrating college graduation at home.
I did not have a graduation. They sent me my degree in the mail and said congratulations in an email.
Jace Kleffner was a Division I athlete, a volleyball player at Winthrop University, being courted for European play when COVID hit.
That is no longer an option. So my volleyball career's ended, and that's it.
Oh, what's that?
19-year-old Autumn went on spring break as Georgia shut down. It did not go over well with her parents.
Ultimately, what we were trying to communicate, at least what I was trying to communicate to Autumn, is that it's not worth the risk. I wouldn't get in a car if there was a 3% chance that the bomb on the trunk's gonna blow up.
We were doing our best to just like be safe-ish, and then as soon as we got home, my dad was like, you have to stay in the basement for 2 weeks because you've been out. And I was like, relax.
We just have to figure out.
Brett and Andy are every parent, trying to navigate with children on the cusp of adulthood,
All right.
trying to protect their health as they keep their own jobs,
Yeah, I don't judge anybody except judgy people.
and trying to keep everyone's spirits up. And as America has discovered, it's a tall order.
Being trapped in here is terrible, and it's depressing and scary, and just, I don't want another day of this, but it keeps happening, so.
Had yogurt all over his face.
There's not a lot of margin for error. Like, nothing else can really go off the rails. They're managing, like, school now is totally different. I don't get to see my friends. My parents are, we're all in the same soup together all the time. So, there's not a lot of latitude for now my sandwich got burnt. Like, that would blow them up because I'm using all my chips just to manage this thing.
A third of Americans are showing signs of clinical anxiety or depression. Census Bureau data taken over 90 days, beginning the end of April, showed a huge jump in anxiety and depression from before the pandemic. Some groups are harder hit than others. Young adults, women, and the poor report higher rates of anxiety and depression. COVID has been hard on our kids. A survey of almost 1,800 children in the Hubei province, China, during the height of the pandemic there, found that almost a quarter of elementary school students had symptoms of depression and 19% had anxiety symptoms after 2 or more months of home confinement.
The disruption of our normal rhythms is terribly anxiety-provoking. The lack of true interaction, the lack of being able to reach out and touch people that you care about and you love. There are things they can do.
Dr. Mark Rappaport is the head of psychiatry at Emory University. He says there are several things we can do to help ourselves.
Talk about it with their friends and others, other people experiencing the same thing. You know, there's almost a sense that of shame about all of this, a sense of, oh, you know, I must be unusual or I must be doing something wrong if I have these feelings. No, everyone has these feelings. None of us have ever been in this situation before.
Rappaport says positive psychology shows that if we give ourselves something to look forward to, such as a trip in the future or seeing friends, it's helpful. And don't sit around.
We need to exercise. We need the physical release. We know that if you exercise, whether you're doing weight training or whether you're doing a walk for 20 minutes or so, we know if you do this, that it decreases symptoms of depression and decreases symptoms of anxiety.
Our lives are not as defined. What's a weekend? Does the workday ever end? Rappaport says we need to draw those lines for our mental health. Take breaks. Switch gears. Actually, physically change locations, even if it's only from your bedroom office to another part of the house. And if nothing is working, seek professional help. Telehealth allows you to safely access resources.
It's not a sign of weakness. It's not a sign of failure. It's a sign of being responsible and caring not only for yourself, but for your loved ones.
In the Veterans Program, we serve post 9/11 veterans. Really anyone who served one day post 9/11 with post-traumatic stress disorder or other post-traumatic symptoms.
Dr. Sheila Rausch is a PTSD expert and psychologist who helps veterans transform and reclaim their lives in the span of a few weeks at Emory Healthcare's Veterans Program.
The intention is really to take all of the best information that we have.
Rausch and her colleagues took that best evidence they successfully used week after week and used it to create a mental health and help guide to deal with the COVID pandemic.
What's really interesting is a lot of what we're going through with the pandemic is similar to what combat veterans experience because they are in a long-term increased risk to life when you're in a combat situation, and then they have these specific incidents that happen. So a specific firefight or a specific loss of a friend, those sorts of specific traumas, and that's a lot like what we all are experiencing who are treating people with COVID or who are going through this pandemic, where it's a long period of increased risk where we're all kind of worried and wondering, and then there are specific incidents of trauma where we maybe have a friend that we lose or a loved one that we lose.
And just being able to come here and
Rausch
have that memory and context.
And Dr. Barbara Rothbaum, a world-renowned PTSD expert and executive director of the Veterans Program, created the guide with Dr. Naomi Simon, a psychiatrist colleague in New York at the height of the outbreak there. It's a phased plan to be used by healthcare workers, employers, all of us. The phases of the plan cover many months and various scenarios, and depending on where someone is at in the pandemic, may recommend seeking mental health help or other interventions. Some self-help tips in the guide include ensuring basic needs for food, sleep, and lodging are met. This is a huge stressor for the millions out of work. Enhance social connection and support. Use strategies that have helped you at stressful times in your life before, like talking with friends and family, exercise, prayer, yoga. reduce unhelpful coping, such as overuse of alcohol or other harmful strategies, and allow people to tell their stories when they're ready. The connection piece is hugely important for all of us, especially those who already have pre-existing mental health conditions.
The people who are most at risk are the ones who are not feeling connection to others, not feeling support. When someone experiences trauma and they feel alienated from those around them, it puts them at a very high risk of having lots of difficult mental health outcomes. It might be PTSD, it might be depression, it might be substance abuse.
The phased approach for mental health response to COVID-19 is already being recommended across the country and referenced for use by the American Psychiatric Association, Anxiety and Depression Association of America, and others.
Overall, people are very resilient. Humans have been a very successful species on the planet because of that. So for most people, this is probably going to be a bump or a bunch of bumps in the road that we're going to eventually recover from and be in a new place. It might not be the same place we were, but a new place where we're thriving and doing the things that we need to do to have meaning in our life.
Well, COVID-19 and the pandemic is the public health crisis of the century. We haven't had, in the last 100 years, a public health crisis that shuts down our world.
It's a bold statement from a man who led the way on another global pandemic. Dr. Jim Curran, Dean of the Rollins School of Public Health at Emory University, was at the forefront of the early days of the AIDS crisis, tapped to lead a CDC task force to figure it out.
If the trends continue as they are, I think we can predict that the acquired immune deficiency syndrome is a highly fatal illness.
A pioneer in HIV/AIDS prevention.
This is Dr. James Curran.
Dr. Curran led the nation's efforts in the battle against HIV and AIDS, a renowned global expert who examined some of the very first AIDS patients in America.
We did a report of the first 5 from Los Angeles. And then I went, that next day I went to New York to see one of the first patients in New York.
This is how he compares the HIV/AIDS epidemic to COVID.
The epidemic doesn't go away. 40 million people have died of HIV and 40 million people are still infected throughout the world. There's no natural end to the AIDS epidemic short of a cure and a vaccine. With COVID, there's more hope that we could put an end to it, because it's only 3 weeks away. The people dying today were infected 3 or 4 weeks ago. Why can't we stop it over the next 4 weeks? And that's our challenge. The advances in science are our greatest hope, and the people who interpret science.
The entire globe is involved.
All of science, maybe it's Tony Fauci, are the people that can provide us the best lens for our hope. You know, and if we don't believe them, then we're really turning down a lot of the future. People have been predicting that there would be a widespread respiratory epidemic for decades. It's here, and we're never going to forget it.
My name is Dr. Samuel Byron Milton. It is a serious condition. I'm a physiatrist and I work at Emory Rehab Hospital. And as a physiatrist, I treat patients who have strokes or brain injuries or any type of neurologic or orthopedic conditions. Yeah, that's right.
Dr. Milton is seeing COVID patients who suffered serious brain impacts from the virus.
We are now recognizing that COVID-19 disease actually has a significant neurologic implication or neurologic effect. And there are right now over 300 studies right now around the world that are actually looking at what are these neurologic effects, how are they caused.
Okay, perfect. One of those studies concerns strokes caused by COVID, even in young, healthy people. Emory neurologist Dr. Fadi Nahab is leading a study to identify blood tests that can help determine which COVID-19 hospital patients are at highest risk for developing blood clotting disorders that cause stroke, heart attack, or clots in the lungs, legs, and arms. A survey published in The Lancet Psychiatry shows that some COVID patients experience a dementia-like syndrome.
Some of the patients, when they're coming into the emergency rooms, are having problems with altered mental status, confusion, delirium. And then some of the late effects have been depression, anxiety, They also have difficulty thinking, writing.
And while it may seem normal to be depressed after a serious illness, research is showing it may be more than that.
There may be real brain issues that are causing the depression. In other words, real issues in the emotional centers of the brain that actually become impacted, that this may not be just an emotional problem, but really a disease process problem that's causing depression and anxiety. We are really learning that this can be devastating for anybody.
You've probably seen the memes on social media, the ones that say, if you have a drink in both hands, you can't touch your face. We laugh, but many of us are drinking more during the pandemic and using more substances. Director of Emory Healthcare Addiction Services, psychiatrist Dr. Justine Welsh.
In my own clinic, I've seen a dramatic escalation of substance use, and not just in individuals who may already have a substance use disorder, who were abstinent or sober and then relapsed, but also in people who are completely new to treatment, who've experienced a worsening of their substance use and a loss of control during the context of the pandemic.
Alcohol industry sales through June grew by 27%. Dr. Welsh says if your drinking hurts your ability to function, take care of your kids, or do your job, then that's a concern. The American Medical Association has seen reports of an increase in opioid overdoses in more than 30 states.
The pandemic has increased risk factors like stress, anxiety, depression, housing and financial instability across the country. These are all risk factors for substance use. It has also decreased what we call protective factors like social connectedness. And for many people, their recovery system is really built upon an infrastructure of social supports.
We are trying to self-soothe during an unprecedented time. Telemedicine is filling the gap for many, providing access to medication-assisted treatment and counseling. But for those in greatest need, the access to help could be jeopardized.
We simply don't have enough treatment resources, and I worry that the gap between individuals with a substance use disorder who need treatment and those who actually receive it is just going to widen, especially in the context of state budget cuts to already underfunded treatment centers.
They are months into their pandemic family life. Jace sheltering in place with her fiance, trying to find silver linings, which can be hard to come by these days.
Trying to find habits and routine, I think that helps a lot. And then it's really easy to slip out of that and get depressed. That's what I found myself doing. There's just no routine anymore, and that's how I functioned as a person.
So I had a reminder.
In talking to the Kleffner family, there is a pattern when it came to what worries them most.
I'm worried it will never go back to the way life was before.
I'm most worried about it just not ending.
The hardest part, I think, is just feeling like you have to give up certain freedoms.
Everything's gonna be fine tomorrow, and then it's really not. It's really just gonna be not fine. This is not fine.
Uncertainty is one of the few certain things these days, and it's not easy for any of us to live like that.
When you ask about children, they're in more formative years. And so yes, it's going to shift them, some in major ways, some in subtle ways, but we're all going to be changed about this forever.
We spend years trying to limit our children's screen time and social media, and now it's one of the only ways for them to connect with peers. Psychologist and former president of the American Psychological Association, Dr. Nadine Kaslow.
You may have had rules before, like screen time rules, that made sense in a different time and place, but actually aren't reasonable or realistic right now.
This one's called the Orange Justice.
It's everything in moderation. But kids are spending positive quality time with their peers on video games or on Facebook Messenger or Instagram or whatever they're doing, Snapchat. That is their social connection. And we don't want children to lose social connection during this time. Make sure that the majority of time we spend with our children is in a loving way. That, you know, you're a parent first, not a teacher first. I know there's tremendous pressure about all the schoolwork, but you're a parent first. And what matters most is your positive relationship with your child, way more than whether your child gets their schoolwork done. Choose your battles wisely. Do not spend all day long battling about everything about their homework, whether or not they get their room clean, how much screen time they have. Be thoughtful about what really matters right now and take stands about that and not about other things.
The dark side of quarantine and sheltering in place is emerging. The UN reports a global increase in domestic violence, reporting it has increased 20% during lockdown, as many people are trapped at home with their abuser.
People are trapped in these situations, and as the economic downturn continues, I'm very worried that these rates of domestic violence are going to increase even more because people who don't have jobs feel worse about themselves, more insecure, and then they turn around and try to exert more control over others.
Another group profoundly impacted are the healthcare workers. Dr. Kaslow has helped lead a team providing free mental wellness support to hundreds of frontline workers and trainees across Emory Healthcare, the Atlanta VA, and the Grady Health System. We yearn to go back or move forward into something better, but most of us will admit to some bright spots.
A lot of children got to spend more time with their parents and with their siblings in ways that have been really nice. They've gotten more family time together, maybe more meals together.
Brett Kleffner says he's learning new habits, new ways of being.
Being aware of habits that make me healthier, start putting habits in place. Even just being, there's a habit. The new way of operating is just to sit still and listen to birds chirp for an hour, because I have an hour, because that would be where I was in traffic normally.
Dr. Kaslow says going back isn't necessarily the right approach.
I'm really concerned when I hear people talk about going back to normal. The normal that we had was not great. There were a lot of problems with the normal that we had. I've heard so many people talk about, I never noticed my garden. I never took a walk outside during the middle of the day. I didn't eat healthy at work because there wasn't healthy food, and now I do that. I didn't have time to just learn what my children were learning in school. We need to take what's been good about this very difficult, challenging time and find creative ways to move that forward.
So how does the COVID story end? With the promise of a vaccine. And among the teams around the world hard at work is one group that has a long history of confronting another challenging virus.
So your question is whether we need to do the DNA simultaneously, My lab works on vaccine development for HIV.
Dr. Rama Amara's team at the Yerkes National Primate Research Center has devoted 20 years to a single pursuit.
What you're seeing here,
the creation of an HIV vaccine. Phase 2 of human clinical trials have been completed.
What we're going to do is a nasal swab.
At the end of March 2020, with the COVID pandemic racing across the globe, they added another vaccine to their efforts, COVID-19.
I thought it is important for us to get into this because we have vast experience with HIV vaccine development for the past 20 years, that we basically learned so much about how to really program the immune system. This is a great sign that all the investment that we made in HIV vaccine development, I think, is coming to really use in this pandemic situation, that we could actually basically run. That as we are making the vaccine.
Amara isn't kidding when he says run. While his team got a later start than some of the 140 plus teams around the world, they made up for lost time. Do you have a vaccine?
Yes.
20 years spent working on an HIV vaccine. 1 month to develop a COVID vaccine. 2 different viruses, with the first providing a foundation that allowed Amara and his team to create what he believes will be a safe, effective vaccine.
Highly confident that this vaccine can provide a significant protection. What we need for protection against this any viral infection is that you need antibodies that can block the virus entry into the target cells. These are called neutralizing antibodies. And if the neutralizing antibodies fail to prevent that infection, that first step, virus entering into the host cell, you need to be able to clear those infected cells.
And those would be the cytotoxic T cells, the killer cells that can destroy the infected cells.
We are trying to combine these antibodies with cytotoxic T cells, these killer cells. Not everybody is trying to do that. There's a lot of work involved. There are so many steps. We are working with challenging times. This vaccine is very durable. We have shown that immune responses can persist as far as like 3 years. We know it is safe, and we know that it is very translatable from mouse to the monkey to the human. Based on our experience with HIV.
An update to this story. 6 months after shooting with Dr. Amara and his team, the results of their research were published in Immunity. The Emory MVA COVID-19 vaccine has proven safe and effective in animals. It can be adapted to deal with variants and may work with just a single dose. Amara and his team were successful at using neutralizing antibodies and those killer T cells to protect against the virus. He hopes to produce a vaccine that can work against multiple human coronaviruses without the need for changing the vaccine as new variants emerge. The hope is to make it widely available by the end of 2021.
That is our dream. That's why we work so hard.
Scientists are learning more every day about COVID-19, how to better treat patients, how to create the best vaccine. Americans have suffered physically, mentally, financially, socially, but hope is in the very name of this show, because it's those fantastic minds in science who will lead the way out of this. Be well. See you next time on Your Fantastic Mind.
Support for Your Fantastic Mind, provided by Southern Company Foundation.